Caitlin Plus. I'm here to discuss with you the impact of IV pump alarms on patient care and safety. There's a lot of noise in the hospital. Phones ringing, intercom systems, call bells, bed alarms, telemetry alarms, IV pump alarms, people talking. The noise can be deafening. It's very polluting, and it affects everybody. It can affect nursing staff, patients, and even family members. For patients, noise pollution can cause disruption in the sleep cycles, circadian cycles, meaning that they can end up sleeping during the day and being up all night. And these disruptions can result in increased length of stay for patients as well as delirium. For staff, noise pollution can cause alarm fatigue, inability to differentiate different alarms, and a reduction in reaction to alarms due to too many false alarms, and we will get into that further along in the PowerPoint. Alarm fatigue is defined as a condition that occurs when a user is desensitized by the presence of excessive alarm signals, non-actionable or false alarms, resulting in a delayed response or no response at all. One study found that on one single unit, over an 18-day period, 16,953 alarms occurred. That is insane. That is a huge amount of alarms. And it's no wonder that eventually over time, people inadvertently start to tune these alarms out, hence the term alarm fatigue. Alarm fatigue is often caused by nuisance alarms. Nuisance alarms are alarms that do not require intervention from staff or are a true problem that is occurring, meaning that these alarms are going off when there's actually not a problem. Studies have shown that a percentage of false alarms can range from 72 to 99%. That's a significant amount of the alarms that we hear. The problem is that when we hear this and we know that these alarms are not true, we end up getting conditioned in a way that we don't believe that really any alarms are true, which also contributes to the alarm fatigue. For this presentation, I wanted to focus on IV pump alarms specifically. All hospitals have them, every floor uses them. An estimated 90% of patients receive infusion therapy during their inpatient hospital stay, with 44% not administered as intended due to alarms. What happens is when an IV pump alarm, the infusion temporarily stops. This can be problematic as some medications have a shorter half-life and medication concentration can be altered, resulting in subtherapeutic or toxic levels. The top 3 drugs found to alarm and not be administered appropriately are IV fluids, heparin, and IV piggyback medications. Unfortunately, med-surg units are at a high disadvantage as number of patients are generally higher on this floor and the floors tend to be much larger. For example, if I have a patient in 37 and I have a patient in 77, it's very difficult to hear one of the other's alarms when you're in one room. According to Vito et al. Study, med-surg floors happen to have the highest average alarm durations of 3 minutes and 25 seconds. If this keeps happening and the times keep getting added up, that's a really long time that patients aren't getting medications administered appropriately. Another thing to keep in mind is that blood products and parenteral nutrition are also administered using the pumps. And if they're not administered in a timely manner, the patient may not get the full amount that they're supposed to get. And unfortunately, you can't just continue the infusion past the time frame because a lot of those products can grow bacteria and cause an infection. And surprisingly, in Vito's study, parenteral nutrition had the highest alarm frequency per delivery. I know being on a floor with a lot of patients and a lot of sick people can be really, really difficult. I know that there have been times where, hey, I don't really have the time to go in and stop that pump from beeping or fix the problem, even if it's not my patient. But the thing is that pumps should always be addressed, whether it's your patient or someone else's. By doing so, you can actually address the alarms and decrease alarm fatigue and also decrease medication administration errors. And it's also a good solidarity of teamwork. One of the things that I'd always learned in nursing school was do not pass go, which means that anytime you hear a bed alarm, any kind of alarm, whether it's your room or not, don't pass that room. Go in and see what the problem is. Maybe you can address it and fix it, and then that decreases all the alarms. The same would go for the IV pumps. I know that going in and trying to find out what the problem is and why the alarm's going off can be really daunting and time consuming. So I'm trying to give you a few tips that are quick and easy to do, and hopefully these will address the situation quickly so you can continue forth and move on with what you're doing. For nurses only, for the downstream occlusion alarms, look to see if the clamps are open. There's 3 clamps on the IV tubing itself, and then there's also one on the IV. Make sure all of them are open. Even if the roller clamp is closed just a little bit, sometimes it's enough where the IV will become included and the pump alarms. Another thing you can do is check the IV placement. If yours happens to be in the antecubital, it's a great open vein. However, a lot of people bend their arms, and so it can get occluded easily. If they have good IV access, see if you can change the IV placement. Sometimes it's just as simple as doing that, and it completely fixes the problem. If you don't have great access or you can't get another IV placed, try utilizing a gauze roll in the antecubital. You can just put it in the crook of their arm, and it prevents them from bending it all the way. And sometimes even just that little bit makes a huge difference. Another thing you can try to use is an arm board. We don't typically have them, but sometimes you can find them, and that can prevent the patient from bending their arm. It's not ideal, but it is something that can be done. In another instance, you can use tape or IV netting, and that's great for when the tube itself is bending, and you can just keep it upright, open, so it doesn't occlude. And if all else fails, grab a new IV tubing. Sometimes it just gets so kinked to the point where it's just going to be permanently bent because it's plastic. And, sometimes you just need new IV tubing. If you happen to have air in the line alarming, there are a few things that you can do. You can make sure you prime the IV tubing via the manufacturer's instructions. I know sometimes we have all of these ideas of how to do it, but they're the ones who made it, and they're the ones who know how to use it. So just go based off their instructions. Another thing you can do is you can disconnect from the patient. Make sure you always disconnect from the patient and expel any air bubbles that are in there. And a third thing you can do is if the infusion is complete, then either if it's a continuous infusion, go grab another bag of fluids, or then just disconnect the patient, flush the patient, and turn off the pump. And if you can't do it, ask for help. That's why we're a team. Never hesitate to ask for help, because sometimes you just need another set of eyes. PCAs are a vital part of patient care. Nurses rely on them heavily. We use them as another set of eyes and ears, and they give us great ideas, and they're just an integral part of patient care. When it comes to IV pumps, PCAs, you guys cannot touch IV pumps. Unfortunately, you just don't have the education or the training to touch them. They're administering medications, which you're not allowed to touch. And you could be silencing an alarm that really needs to be addressed. So it's important that you still help us out. And if you hear any pump alarm go off, just let a nurse know. It doesn't have to be the nurse taking care of that patient. Just let any nurse know, because they can go and address the alarm. And if there's further information that's needed, then the nurse themselves can go find another nurse who's taking care of the patient and get more information. Healthcare is a collaborative team effort. Whether it's a PCA alerting a nurse that the IV pump alarm is going off, or another nurse just simply helping out and addressing the IV pump alarm, it's important that we can continue that team effort to address these IV pump alarms. Addressing these alarms can improve patient safety and patient care, as well as decrease alarm fatigue and improve response time.